I'm going to meet up with my friend John. We've been high school friends, so known each other for a really long time. We ended up in the same city after, which I guess this is not that crazy thinking about it, but yeah, he's a psychiatry resident right now, so I'm gonna go meet up with him too.
Interview.
You don't want to be in it. Do you want to talk about who your partner is?
Yeah.
And yeah, how you met them, how long you've been dating?
What up, YouTube? I'm John, and I'm a resident in psychiatry, and I have been with my partner Diana now for like over 8 years.
Mm-hmm.
We met in college. Met pretty naturally through a mutual friend who ended up being our wedding officiant. We started dating our junior year, and we made it through medical school. Both went to medical school in New York at different schools. And then we got engaged towards the end of medical school, right before COVID was happening. And then last year we finally had our wedding.
Nice.
And she's also a resident in internal medicine at another hospital in the city too. So we've been in New York for like almost 8 years in medicine, but never at the same like hospital system.
Yeah, that's actually like insane life luck though.
It is, yeah.
How many times did it feel like dangerous that like things were gonna diverge like geographically or?
Going into medical school for sure, that was possible.
Yeah.
Because I actually got into NYU off the wait list before I got in. Oh, and she got into her school, Cornell, off the wait list.
Oh.
So before we had decided to come to New York, we had a plan to go to 2 other schools and do like long distance and try that.
Yeah. Where were they?
She was gonna go to probably Case Western.
Mm-hmm.
I was probably gonna do UCLA. Then pretty shortly after, so like in medical school admissions, there's like, I forget what day it is, but like there's a day when waitlist stuff starts to come out.
Mm-hmm.
And pretty shortly after that, we both got off the wait list at our school. So it wasn't like we were waiting a while.
Mm-hmm.
So then we could like luckily make the plans for New York based on that.
Yeah, I feel like that is honestly harder than even like the match. Like
Yeah.
in a way, because it's like
For
not
couples,
like a
for sure.
Yeah, it's not like a formal thing.
Yeah, in residency, luckily we had the actual couples match, which
Yeah.
allows you to rank all the combos
Yeah,
that you and your partner would want to stay together.
yeah,
But I feel like med school admissions is crazy because like even for a single person,
yeah,
like it's so hard to get into med school, so people
Yeah.
just end up like in the middle of nowhere.
yeah. I feel like something else that like comes up is like, would you prefer to date a doctor or not a doctor? But obviously, like you went through the whole thing together. Like, do you see any like disadvantages of that, or like any advantages, or?
I think it's something I'm overall grateful for because you have that understanding of what each other went through for like medical school, and also currently for us in residency. Like even though we're not in the same field anymore, we still at least know what it means like be on call, like work overnight, like long hours, like you have a sense of what the other person's doing in their workday.
Yeah.
So that's nice. Like we can connect pretty easily on like talking about what happens at work and like have the same language. Even when it comes to like talking about patients, like let's say this patient was hard for this reason, you kind of understand that.
Do you feel like I feel like the question for you would be like, would it be too much to date someone within your like own specialty also?
Yeah.
I feel like the same like different specialty is like that's spicy enough to like keep things still like interesting.
Yeah.
Yeah.
It keeps it interesting for me because like I kind of miss like internal medicine sometimes. Like occasionally we'll say like there's this really interesting patient or something, like this either like rare diagnosis or like this eventful thing happened, and I'm like, oh, I like hearing about that because I kind of miss like hospital medicine sometimes.
You're like, I regret all my choices. I should have done medicine instead. Do you think you've like changed a lot during residency to the point where like it's affected your relationship at all, or like not really?
I think I've definitely changed during residency. I don't know about like to the point where it's affected our relationship. I think we're still doing well, but definitely like my feelings about the work have changed. Yeah. And it's only natural that just like bleeds into the rest of your life too. Like residency was pretty demoralizing for me in some ways. And so I think that made it hard to like sort of, you have to come home and then your partner has to deal with all this like frustrating shit that you went through during the day.
Yeah, I feel like I found like way more like short with people, like a little bit like I don't know if that's like burnout or like after like maybe I'll like not be like that, but
yeah. Me too. I don't know if it's coming out as like being short, but I definitely feel like I have less patience.
Yeah, yeah.
once you have a few patients that are hard to deal with, just like empty your tank over the years of residency, it's like hard to fill it back up. Like right now I have a ton of free time, but I still don't necessarily feel like my tank is back like refilled.
Why do you think that is? Because like you know you have to do work again like per week or something, or like
I don't know. I came into residency like really feeling like nothing but excitement for psychiatry. Like this is a slam dunk field for me. 10 out of 10, perfect career for me. Over time, like it just went down because of like how challenging it was. So, like not to the point. I actually never reached a point where I like regretted it or anything. But still, it was like okay, some of the excitement's wearing off, and it's going from like a 10 out of 10 to like a 9 or 8 out of 10 to like a 7 out of 10, and then like it just sucks to feel like that's slipping away. And now I'm like towards the end of residency, and actually like things are a lot better where I can actually do a lot of the things that I was originally excited about. But it's hard to like find that like innocence again, I feel like, of like when we were graduating medical students and just starting the field and feeling excited. I don't know, it's just not there. I hope it comes back.
I just remember feeling like really like scared at the beginning of residency. So I don't even know if I like how excited I was. Like mostly just like fear. That got replaced by like the burnout. I mean, I don't know. I'm like half joking. I mean, I do really like.
Are you saying that you're not afraid anymore?
Definitely not. I feel like I've grown, like matured in like my ability to deal with stress though. But maybe that's come at the cost of like being a little more like burnt out. Maybe. I don't know. Do you think you're more excited about medicine or Diana?
I think I am. Medicine or like psychiatry?
Just like the field of medicine.
I would still say B. Like I liked being a medical student at the end of the day. Although clerkship year sucked, I did not like that year. The rest of it I generally liked.
It's fun.
It's fun. The science aspect of it I've always liked. I think more than her. Like learning about the physiology and all that. Like one of the things I miss most about like not doing medicine. I'm also more excited about my chosen field of psych, I think, than she is for medicine and endocrinology, which is what she wants to do. Not that she's not excited, but I do think like for me, it's much more of like something I could see myself doing like for the rest of my life.
I feel like in residency I've met like people who are like very like super burnt out and like really like just realize they don't like it. I feel like interacting with people who are too against it is like really draining in its own way. It would be probably hard to be in a relationship with someone who's like that, not happy about it or something.
Both of us are generally pretty easygoing and more optimistic leaning people. Like even when we were in intern year, the hardest year, we could still find ways to like be excited about what we're doing and appreciate that things might get better and like take account of the positives. But I do feel like that was something that contributed to my burnout, like being in this residency, because like my residency class and our program as a whole skews towards like pessimistic, like upset and many things. And while I think it's like rightfully so, like residents should be voicing things when you're upset about something because that's how you get things to change. It also is a draining like culture to be in. A lot of what we bonded over was like complaining about shit. Do you think it's like hard to then be like dumping or like complaining to like your partner about like, I mean, like how bad your day was or like something annoying or... For sure, I think that's like the source of a lot of negative emotion for us sometimes is like just when things get carried over from work. Like just the other day on this SF trip, we were like having breakfast before our flight and we were like sitting in the park, like we just got some dim sum from like a takeout place and everything was nice. But then I get this text that's relating to work about this like upcoming event this week and all of a sudden it triggers this like hate spiral for me of like I can't believe like, you know, this part of it's like not planned or it reminds me of this thing that happened in work and all of a sudden like this negativity just starts coming out and I'm like voicing it out loud and it's like bringing down the mood.
But Diana's trying to enjoy the video.
Exactly, She was like, I mean, it's okay that you're like saying this, but you should lower your voice because there's some nice like Chinese grandmas over there doing their yoga.
I feel like I've never seen you like really mad though.
I wasn't like shouting. But it was just like I was talking more loudly.
You're talking like 1 decibel higher. I'm furious.
But no, dude, one of the best experiences last year, actually, for a year, I was seeing a couple for couples therapy, and I had to be the couples therapist, and that was way out of my comfort zone.
Yeah.
As it was for many of my co-residents too, because that's like generally the only time, probably in our careers, unless someone chooses.
Is that like that's a required thing for you, like couples therapy, or?
It was required for us. I don't know if it is everywhere. For us, it could be either a couple or a family, but there were fewer family cases, so most people had couples. But yeah, that was really difficult for me, and I guess I think I learned. It's hard for me to put into words what I learned from that, but intuitively it feels like I gained something from that.
That's all residency.
Yeah.
I think I learned something.
Yeah.
Did they have any problems that like drew parallels like to your own life, or like not really?
Like, yes, a lot of their problems were like for sure their own stuff happening, but they also generally, and I think pretty much every couple is going to have this at some point, just have like communication problems, where it's like one person wishes the other person would do like more of the chores, but is not communicating that the most effectively.
No.
And then when the other person doesn't do it, well, it's like, how would that person know if it's not communicated? They would have to read the other person's mind, essentially.
Yeah.
But for some reason, like, couples, I think, expect actually that their partner can do that sometimes, like read their mind and know what they want at all times.
Yeah. Like, are you trying to teach them techniques, or are you trying to be like, this is what they're saying, like translating for them almost?
It's a mix of both, and there's different theories of couples therapy and what to do about this. But what it ended up being for me was like both a mix of like trying to understand what individually was happening for each of them, but also teaching some techniques. There's a classic one called the speaker-listener technique, which I think is developed by Esther Perel, who's like a known therapist. And she basically encourages people to like have a structured time where one person gets to speak what's on their mind, and the other person must listen and then like restate what they heard to make sure that they grasp the meaning of what was being said, and then switch so that each person gets a chance to communicate and then also know that their partner heard and understood what was being communicated. So like during our sessions we would say, okay, let's practice that, and then before our session next week do this like 3 times at home or something and see what comes up.
Yeah, it's like, I want you to do the chores, and they say, so what I heard is, you think I'm an asshole. It's like that.
Yeah.
Was there anything like that you learned from them? Is something good that they're doing?
I don't know if I've learned this, but it was nice to see that even when they were having conflict, they would still always at least be like supportive and affectionate and like still friendly with each other. They could be having the most heated, they did have occasionally like some heated arguments right in front of me during the sessions. But by the end, usually, they would still be able to like come together and say, okay, yeah, like this is not resolved, but at the very least, like we'll still walk out of here like, holding hands or like making some jokes at the end of the session. Like it was always nice to see them still be able to do that.
Yeah. That's really cute, actually.
It is, yeah. Which I don't think like every couple can pack their conflicts in as well as they did, because some of their conflicts were really bad. Like, yelling, like you definitely don't love me, like all this stuff. But for the most part, they could put it all away at the end of the session, which would always impress me. It was like nice to see, and like nice inspiration for me to be able to do that. And, like realize that like in the heat of the moment, something feels like it's the most important thing ever, but it's gonna pass. Yeah.
That's not something you would want to do.
No, after seeing them for like, it wasn't the whole year, but it was several months of like weekly. So a decent amount of time, I felt pretty sure that I don't want to be a couples therapist. One of the hardest parts is like you're told, or we were told by my supervisor explicitly, you're not there to take a side. So even when it seems like one person is right, you can't be the referee and take someone's side, because that's not what you're there for. It's also why it's proper form that like if you see someone for an individual treatment, like individual therapy, you should not be their couples therapist.
Oh, I don't know that.
It should always be separate.
Because like you're gonna want to take sides.
Exactly, yeah. You'd probably want to either align or maybe like stand opposite from the person you already know.
Actually, something I was also curious about is like medicine. There's like a lot of people who are like, I want to be the medical director for like this place,
Yeah.
or I want to be like the expert at like this, or like I want to be like a researcher, or I want to like be the program director, and all those are like pretty significant like time commitments.
Mm.
Do you think you've ever had to like be like, oh, I'm not gonna do this because of like the relationship, or you probably would have done like this or that regardless?
For me, nothing like to that point, but because of like medical pathways of like med school residency and how structured it is, even now, like I am having to think about my partner and like my career moves.
Yeah.
I think if it was just me, I might have done an addiction psych fellowship directly after graduating this year.
Yeah.
But because she's applying for her endocrinology fellowship, it would be like too much happening at the same time for me to also try to go for a fellowship, and then like both of you don't know where you're gonna get accepted, and you want to stay together. It's too much of a headache to go through that, so I'm putting that on hold. And I'm just gonna get a job where she matches for a fellowship and see if I want to do my fellowship later or not at all.
Yeah.
And I think sometimes because of like the structure of medicine, you have to do that like mental gymnastics of like even in the couples match, what are you willing to go for together and things like that.
Do you think that is a fellowship more work than just like an attending job? Do you think, or
the pay's less,
Yeah,
for sure.
for sure.
Work-wise, it's probably like the same. If not, maybe even better to be a fellow.
Oh,
Because
okay.
when you're a fellow, you have less responsibility because there's always attending oversight.
Yeah.
Like that's one of the things I'm nervous about to be an attending. I don't think psych fellowships are known to be stressful really. Like there's no call,
Yeah.
there's no like weekend or overnight responsibilities for the most part.
Yeah.
But I know in other parts of medicine, like fellowship's much more of a serious thing and it is stressful.
Do you think I guess like because she's IM, fellowship is like more important. I don't know if important is the right word, but it's like more important than psych, I guess.
Yeah, that's gonna like make or break her career because in
Yeah.
medicine, to do a subspecialty like cardiology,
Yeah.
you have to do the fellowship.
Yeah.
Like there's no way around that. Whereas that's not really true for psych,
Yeah.
luckily, except for maybe child psych.
Mm-hmm.
But otherwise, the other psych fellowships are kind of like icing on the cake.
Yeah.
You don't really need it at all.
Yeah. But do you have any advice for people who are in residency or like in a medical couple? Like,
Probably to try to achieve work-life balance as much as possible. Even in the times when you're not with your partner, to do nice things for them or to do nice things for yourself.
or just only nice things for yourself.
Yeah. I mean, it's hard either way.
Yeah.
Like in residency, it's gonna suck, but you just gotta get through it. It's nice that it ends. It's not infinite.
Yeah.
And yeah, to like, sometimes our schedule is not in our control often, which
Yeah.
sucks. But when it is, or when the schedule happens to line up, that you can spend good quality time with your partner,
Yeah.
to not take that too much for granted.
Yeah. Thanks for doing this though. I mean, I didn't think people were gonna say yes. But then
Why not, dude? This is fun.
I don't know. I mean,
I'll do it again.